Dr. Delaney, it is so great to have you here with me today. DHA Lab is so fortunate to have you as one of our featured speakers on our webinar series. Your background in biochemistry, especially the Walsh model and protocols, are a highlight for us in our core testing. And we can't thank you enough. And I don't want to take any more time. I really want to hear, how you got to be doing the work you're doing and the populations you typically serve, and your why essentially in the industry. And then I'll kind of let you get going as far as talking about biochemistry and ADHD and how you're working with that population.
Thanks for having me. I really appreciate this opportunity to talk about ADHD and the protocols that are really helpful for these kids. So my background is that I started out in healthcare as a nurse, an RN, and worked in various hospital settings, burns, trauma, ICU, and then floated around the different hospital settings. And I did that for about 8 years. And then I went to naturopathic medical school, started in California and ended up my last 2 years in Oregon. And after that, I traveled to India to work and study with a homeopathic Dr. Jugal Kishore in New Delhi, and came back after a year and a half to North Carolina to practice as a naturopathic doctor with focusing on homeopathy. And so from there, I learned many different therapies, nutrient therapies, nutrition, botanical medicine. But in particular, I heard Dr. Walt's lecture one time and I said, I don't know who this guy is, but I certainly want to study with him. And I have for the last 10 years, and learned a great deal about how to help people in the field of mental health. So that's what I'm deeply passionate about. And I practice in Carver, North Carolina, and in a group setting with a variety of other practitioners who do acupuncture, massage, and psychotherapy. So that's where I am right now.
We are so thrilled to have you, and ADHD is a tough one, and I think a lot of people, no matter who they're practicing with, no matter what their client or patient populations are, they're being exposed to ADHD, and it's something that maybe you may not know exactly what to do with and what the root and foundations are there. So we're so happy to have you, and I'll let you take it away.
Here we go. So we're going to explore some options for treatment with natural therapies today, in particular ADHD. What actually is ADHD? The criteria for it, what is a ADHD typical person like versus a neurotypical person, some association with other disorders, how to address the underlying imbalances, take a look under the hood, as I say, and then some other natural therapies to help support the healing process. So I think I'll start with a little bit of quick history. In 1998 was really the first time ADHD was recognized, and it was called hyperkinetic reaction of childhood. Interesting labeling. And it was only in 1980 that ADD with or without hyperactivity came into being. These are DSM diagnostic codes, and this is where this information came from. So in 1994, it was identified that there were 3 different subtypes: inattentive, hyperkinetic, and impulsive, and then a combination of these 2. So in 2013, ADHD just became the only diagnostic criteria. They eliminated ADD, and now it's called ADHD. And it has 4 inclusion criteria. So now to be diagnosed with ADHD, you have the core symptoms of inattentive, hyperactivity, and impulsivity. These symptoms need to come on before the age of 12 and persist longer than 12 months, 6 months rather. What's really key here is this condition needs to have an impact on your daily functioning at school, at home, or even in the workplace. And they have some exclusion criteria and differential diagnosis. That means the symptoms are not explained by another mental disorder, or they do not occur just sporadically with psychotic episodes. So that's the criteria that Western medicine uses for determining, do you have ADHD? Now, looking at this sort of differently out of the box, it's recognized by most people that it's really not a disorder, but a condition, and a different way of looking at it. So in medical school or in high school, wherever you study science, we looked at the nervous system as something that moves muscles, gives you pain, sends signals back and forth. It's a very restricted way of looking at your nervous system. But in truth, it regulates all of your attention and your emotions. And if you have an ADH nervous system, it just works on a different set of rules. And what I think is really important to understand is that these people are not always overtly hyperactive, but they are internally hyperactive. And they don't have a shortage of attention, but they pay attention to everything. 4 to 5 things going on in their head at once. And so what you have really is something called inconsistent attention. And most of you have probably met some of these kids, even adults, who are really brilliant and they can focus and they get in the zone, they accomplish these things, they're bright, really clever. And that comes into play sometimes for them during the day, but they can never really be sure of their abilities that they'll show up or they'll get in this zone. So remember, it's not that they're not paying attention, they just have inconsistent attention because everything is going on in their little brains. So ADHD has what you call an interest-based nervous system. You're ultra focused on the things that you are interested in. They get into the zone. But the problem for them is that it's unreliable. Parents will say, he is so focused on looking at trains in the early part of this country. You can't pull him away from that. But then he can't remember to do his homework. Okay. And so there's complaints that these kids are unreliable, they're forgetful, they're self-serving, they just have inconsistent attention when you're trying to talk to them. So, but it turns on the zone when you're focused on what you're interested in. And the zone can also be turned on when they're thrown into a competitive environment, playing sports or something is going on. They can turn that zone on. And they also can turn it on in a do or die situation. They have an urgent deadline. But then things get old and procrastination sets in. You can see this in people who are excellent in emergencies. They can just be there, be the most efficient and helpful in a crisis, for instance. So this is really different from a neurotypical person, which most of us probably are. Not everyone, but you and I maybe have a concept of we got to do this because it's really important. This is an important task to finish. We might do a little wiggling around and procrastinating, but we have a deadline, and then it's important to us so we can complete it. And another thing is that we should get this done, this sense that teachers and parents say, well, this needs to happen. So that is one of the bumpers or things that keep us in line with following through. And then there's a concept of rewards and punishment that you're going to get a D on this report if you don't hand it in. You're going to get an A in it if you do, and if you do a really good job. So neurotypical people have these little constructs in their brain, which are not there for people with ADHD. So here comes the problem. They're focused on so many things, and in school, you're told what other people think is important, like your teacher and repetitive learning, and you don't really care about algebra. And so you're not going to probably do your homework. Again, in life, working for the boss, someone who thinks something is important, it's not really important to you. A disorganized system with prioritization and time management. Everything is happening right now for them. And so they have a difficulty choosing between alternatives. Everything has the same lack of importance unless it is important to them. So I have on this sheet lots of information about why ADHD people feel like they're from another planet. And I'm not going to read it to you, but I do want you to take a look at it. One of the most interesting things I found when looking at this is that ADHD people are sensitive. They have rejection sensitive dysphoria, that they experience a lot more emotional pain internally than other people uh, see in them. And so this sets them up for anxiety, depression. I'm not good enough. People aren't, they're making fun of me. What's going on? I think that's really important to understand about these children and these adults. And they also experience their life much more passionately and intensely. They have excessive energy around there. And so, because they can't stay focused, they have difficulty learning and they have little self awareness that how they're doing or the effect they're having on other people. So, people might think they're sarcastic and or uncaring, they're socially inept, which sometimes they are, because they don't understand the situation. And so I think if you're interested to go ahead and review some of these on your own, because these are some of the problems that they experience in their lives. So one thing that's really, really important, and if you don't go away with anything but this um, piece of information, is that people with ADHD, 80% of them have other emotional disorders. And like I was saying, with anxiety, they can't figure out where they stand in a social situation, makes them very anxious. They don't trust themselves. They get depressed because they're rejected. The question becomes, is this a chicken or an egg? Um, do they have depression already and ADHD, or does the ADHD actually contribute to depression and anxiety? I think it's a little of both. They can also be associated with bipolar disorder, OCD, and oppositional defiant disorder. So, along with these children who have ADHD, you are going to see a lot of this oppositional defiance and OCD and anxiety. And I have a case that I'll talk about in a bit about this particular thing. So, the most important thing with all of these disorders is that we're treating the disorder, whether it's ADHD, oppositional defiant, OCD, depression, anxiety, by looking at the underlying biochemistry. This is key. So all of these conditions have underlying predispositions. Okay. And one of the most important things that you can do is read this book by Dr. William Walsh called Nutrient Power. And there's so much biochemistry in here, and it goes way beyond what I can talk about in this hour. I'm really interested that everyone get this book. You can get it on Amazon or from the walshinstitute.org and read that and keep rereading it and understand it as much as you can. And so I want to tell you a quick story about how Dr. Walsh got into this work. He's a biochemist and worked at Argonne Science Lab in outside of Chicago, Illinois. And he and a group of scientists and other workers from that lab were volunteering in a prison system in Chicago. And so they were helping get these prisoners reunited with their families. And what he saw often was that there'd be two really loving parents, and then a couple of kids, happy, well adjusted, doing well in school. And then there would be this one son who had just deviant, aberrant behavior. And Dr. Walsh was very interested in this because during that time, autism, ADHD, the problem was put on the parents. Very sad to say, a lot of parents were blamed for autism in their children, that they weren't loving and weren't caring. And over time, Dr. Walsh understood this not to be true because way too often mothers would say to him, he has been like this since he was born, which meant to Dr. Walsh that something else was going on. In his scientist mind, he went, there's something that's got to be underlying in this biochemistry. And then began his adventure in testing hair and urine and blood in these prisoners, which then he published some work and then worked with Dr. Carl Pfeiffer at Princeton, working particularly with schizophrenics and criminals. So you can read more about that, but that's where this whole system by Dr. Walsh and Dr. Pfeiffer came to be, by parents saying, he's been like that since he was born. So talk about the Walsh protocol. Dr. Walsh started out doing multiple testing, and but he has come down to 4 big tests that can be done through DHA and LabCorp in particular. Does the testing with the DHA. So it's serum copper, plasma zinc, ceruloplasmin, and whole blood histamine. Those are the 4. And that's blood. And the other testing is urine testing for cryptopyrroles at DHA labs. And they are really the best lab to do your cryptopyrrole testing. It's about $100. The people do that, take the testing home and do it at home. Other testing that Dr. Walsh really likes to do is a complete metabolic panel, a CBC, iron, ferritin, vitamin D, and TSH. And these can be done, through the pediatrician or your other family doctor. But these are really important tests that should be looked at too. Is this person depressed because their TSH is too low and they're hypothyroid? Is their TSH too high, too low, like a 0.03, and they're really anxious and having diarrhea and can't eat very well? So that's really important. That's known. I think the vitamin D is essential as well, because I've tested lots of children and their vitamin D are 12 and 16. And we know that vitamin D is important for the synthesis of serotonin and dopamine. A CBC will let you also know if you're anemic, and you need iron to be make dopamine. That's an essential component of making dopamine. So you can tell if the iron is too low or actually too high in some cases if there's hemochromatosis. And then the complete metabolic panel takes a look at your liver, your kidneys, and things of that nature. So that's the testing that needs to be done. So let's talk about some of them. These are the levels for optimum health, not the levels on LabCorp testing, because the ranges are slightly different. So for zinc, it's 90 to 135. Copper, 70 to 110. And then ceruloplasmin is a protein that actually follows the levels of copper. Okay, and here's a quick story that was told to me by Dr. Bowman. So think of copper as the school children and ceruloplasmin as the school buses. And if you don't have enough ceruloplasmin or school buses, at the end of the day, you go pick up the children and there's not enough buses. So you have to leave those copper children at school, and then they are like, they cause oxidative stress on your brain. So think of them as breaking the windows, pulling out the internet, and then destroying, turning up the desk and destroying everything in the room. That's called free copper. And that's what ceruloplasmin and deficiency of that with a high copper can cause in your brain. So that ratio of ceruloplasmin should be 1 to 4. And so that means if your copper is 100, your ceruloplasmin should be 25. Okay, in that range. So the other lab that is used is whole blood histamine. Now, this is a marker for methylation that is determined at birth. And these people, whether they're over or under methylated, it presents with a whole different treatment process. And I'll talk more about that in a second. So there are three key points in looking at copper and zinc. So number one is the absolute numbers. So if your copper is 127 or 130, that's too much copper. Or your zinc is like 83 to go with that, your zinc is too low. And zinc is a really important nutrient for making in the process of GABA and also serotonin and dopamine. So what you really want to see, so first of all, the absolute number is one place to look at. Secondly, is the ratio of copper to zinc out of whack? It should be 1 to 1. So if someone's copper is 100, their zinc should be 100 as well. So that ratio is number 2. And the percent free copper is what I just discussed. Is your copper bound or unbound to the ceruloplasmin? And that ratio should be close to 1 to 4. Okay? So if you have a high copper and a low zinc, these are some of the things that you can expect to see, the symptoms in these kids, whether they're defiant, ADHD, or just pre-criminals, whatever these children, the way they're behaving. You'll see hyperactivity. They don't do well in school. They have high incidence of learning disabilities. They have complete emotional meltdowns, throwing things, anger. They're very anxious. Certain things will make them very scared, going to school, being in crowds. So they can get aggressive because their anxiety is too high. They have poor concentration and focus, and they have difficulty sleeping. So on the other side, you can see a couple of things that you might see in their physical being, like they have white spots on their nails, their skin is sensitive. Mom, I'm not wearing this coat because it's too itchy, or there's a tag in my shirt. They have a poor immune function. They might be getting sick a lot, ringing in their ears. There are many more. And estrogen intolerance, which is sometimes where we see some behavior difficulties happening in young women when their periods start. And in older women, when they start the birth control pill as well, or problems with their menstrual cycle. So there's another place you can look for these copper zinc imbalances. Whoops. So urine cryptopyrroles. So this is a test that I said it's done at home. It's frozen and sent into DHA labs. And a normal test would be anything under 10. Mild symptoms of ADHD, of high urine cryptopyrroles start to show up in the 10 to 15. You'll definitely see them in 15 to 25. And severe symptoms of cryptopyrroles are 25 to 100. I have seen the highest was 120. Two deviant young men who were 78 and 76. And those kids were people who were born that way and
Wow.
experienced difficulties their whole life with that elevated cryptopyrroles. So the issue of cryptopyrroles, it's not like a toxin or mercury in your blood or lead, something like that. What it does is it depletes your body of zinc, B6, and P5P. So you can hear the sucking sound of when your cryptopyrroles are being high, pulling those nutrients out of your body. And so these are 3 key nutrients for making all of your neurotransmitters, zinc especially, but B6 and P5P are different forms of B6, pyridoxine and P5P. So Dr. Walsh and Dr. Pfeiffer realized that some people responded better to B6 and some people didn't at all. So some people responded better to P5P and not to B6. So there's unclear of which is which. So they use both of them, it's probably something genetic that people can process it better. So he gives B6 and P5P together at the same time with the zinc for elevated cryptopyrroles. Note, I wrote, this is a marker for oxidative stress. If you have high cryptopyrroles, it means your brain is being very challenged. And sometimes it means that your body is being very challenged as well with a chronic illness, infection, and occasionally it can be cancer. So that's important to know. So again, here's some more symptoms of these imbalances, this time elevated pyrroles. Poor stress control. These kids are fearful, they're irritable, they have terrible tempers, they can be depressed, they're obsessed with negative thoughts. Again, this shows up in their memory. They have problems with reading disorders, and they have severe inattention and anxiety. On the other side, you can see some of these things. They don't like to eat breakfast, okay? And they kind of refuse it. They can also have frequent infections. They're very sensitive to light noise. They have dry skin, but they do tend to like spicy and salty foods, and they stay up late. And again, note that they're under severe oxidative stress. So both of these, the elevated copper and low zinc and the cryptopyrroles, have a lot of the same symptoms that you would say looking at ADHD. So I, again, it's useful to classify these for traditional way of thinking, but really the way I like to classify them is through the disrupted biochemistry. Okay. So I said I would mention whole blood histamine, but we're not going to focus on this. As I said, this was a marker that's determined at birth, but it really does help sometimes to figure out what's happening with ADHD kids. Normally methylation should be between 40 and 70. If you're under methylated, it's greater than 70. If you're over methylated, it's under 40. And think of this like if you're hypothyroid, your TSH goes up. And if you're hyperthyroid, then it goes under. So that may help you remember that distinction there. But most of your ADHD cases are going to be found, the treatment will be in copper zinc imbalances and urine cryptopyrroles. However, I will mention this. I have a sister who I tested one time, and her histamine, whole blood histamine marker was 187.
Wow.
Very, very high. And but she's not depressed, she's not anxious, but she has severe ADHD. And it worked for her in her life. She raised 4 children. Her husband was a pilot, so she kind of did it on her own. She runs a farm. It's just like on the go all the time. But I will say what she managed to do in her life is in her 20s was to join the military. And that's where she was forced to learn certain skills of organization. You're going to wear this, you're going to show up at this time, we're going to move you here. And that helps these ADHD people a lot, giving them structure. And as you may know that a lot of ADHD people are in the military, and they are thriving there because they have superimposed structure on them. So you can find this in whole blood histamine, but like I said, it's working for my sister.
Hey, Dr.
So,
Delaney, I have a quick question about that. So,
sure.
when you first started covering ADHD, to me, it sounded like there is some overlap when it comes to undermethylation and ADHD. And I'm sure it's glaring when it's ADHD and not just undermethylation. And we want to look at pyrroles and zinc and copper as a priority and ceruloplasmin, as you
Mm-hmm.
said. But if you're working on someone's undermethylation by testing their whole blood histamine, seeing where their methylation lies, and then helping them, get to the correct methylating status, is that going to help affect ADHD symptoms and ADHD? Are you seeing over under methylation in ADHD populations? Because there seems to be some overlap there.
Yes, there is overlap. And like I said, I do test for a whole blood histamine very often. It's not an effective test if the person is taking an SSRI or
Mhm.
SNRI, like Wellbutrin, Prozac, and things like that. And it's shocking how many people are taking those drugs to help manage their depression and anxiety. So the whole blood histamine test, if a person is taking SSRI, or even antihistamine, is not an accurate test. So sometimes, I'll talk about it in this case right here. Um, it is an effective tool to use because it really does help. And in this person, she's over methylated. Okay.
Interesting.
Yes.
Thank
Yeah, I do use that test as much as I can, but avoid doing it if they're under methylated.
you.
So this is my first case. Now this person came to me because she was complaining of being overweight, and she was 195. She wanted to be 165, but she just couldn't get it together to organize her food for lunch. So she would go out and get a cookie and a Coke every single day. Well, no, that's why she weighs 195 pounds. So I listened to the whole story instead of giving her a menu. And the whole story is that this person has severe ADHD. No wonder she can't get her lunch together. So she was like this as a child, and she talked about working harder than most of her friends and her sister. She would work 3 times as hard to do her homework and didn't get as good a grade. She had difficulty studying, focusing. She only had average grades, and she just preferred to be active, running around, loud, and playing and making friends. I will note that she drank 2 Cokes every day of her life, but that probably helped her a little bit with the caffeine to focus a little bit better. And she was just anxious and depressed. And again, here's the chicken and the egg thing. Did she feel anxious because she couldn't get her homework done? Because she was constantly being told by her mom, you can't do this, you're not doing that right, blah, 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 blah. And just had difficulty feeling like she fit in. Like ADHD kids feel like they're from another planet. So here is these are her labs. Let's look at this, her zinc level. So her absolute number of zinc is low, and her absolute number of copper is too high. So the zinc, she would be better in the 125, 130 range, and the copper needs to come down to uh, under 110. Okay. And when we look at that ratio, it puts her at 1.4. So remember that copper zinc ratio should be 1 to 1. So she's already got 2 markers that are really helping her brain not function well. Then her ceruloplasmin, it's not 1 to 4, that ratio. So her percent free copper should only be 25, and it's 31. So she's got some free copper running around in that classroom pulling out the internet as well. And then she is an over methylator because her histamine is below 40, and the range is 40 to 70. And then she has a low vitamin D level as well. When I saw these labs, I went, oh my gosh, no wonder this person is having difficulty. It's not just about her food. She can't get her life organized, and it's difficult for her at work to stay focused and stay on her task. So she got the appropriate treatment, felt much better, dropped her weight down to 165, and she was doing very well until she stopped doing it. And I'm very certain that she has some inborn errors here, but within the last 3 months or so, she actually is back on the protocol, understanding that she needs to be on it for a long time, maybe for life, and she's doing better once again. But that's common. People do really well. I don't need this anymore. I'm fixed. But sometimes adults and kids need to be on this some of it for life. So here's my second case that I had with a mother of about 30 or 40, and she called me to get help for herself because she was a wreck. She was crying, overwhelmed, depressed, and anxious. And when you dug a little deeper, turned out to be her son. And this is a young man who is 10 or 11, and he was adopted. And so he was struggling with that. But his behavior was such that she was terrified of her son. And she wasn't sure when he would lash out with his brother or at her. In public, he would push and grab her and seemed to get a little bit too much joy out of making her scared. And he was struggling on his own with kicking and punching. And then when he was at school, he could sort of hold it together because it was important for him to be accepted by other kids. But he did have problems reading, and he can't stop talking. And it was just difficult for him to sit still. He always needed redirection. So they had labeled him as ADHD, but she did not want to do the uh, medication for him. So instead of treating her, we turned the page and started treating him. Well, one thing that's really interesting is that this kid was having nightmares, and he would come in the room and spend 2 or 3 hours with them talking and being upset. And another piece is that he was bedwetting 3 or 4 times a week. It's important to know, as a little tidbit for you, that bedwetting in children at this age, or really any age, you should think of food allergies before you do anything. That this is probably what's going on. You don't have to do the testing. You can just eliminate certain foods. And by far, the most significant food that I take out of these children's diet is dairy. And I have a 16-year-old client who is bedwetting every single night. And once he stopped eating dairy, completely went away. And his life
Wow.
changed. It also changes their brain as well. And even before we started the protocol for this young boy, the mom said after taking him off dairy, his brain was getting better. He had less intense and less often mood swings. So that's one thing to think about too. So you can see he has a very uh we'll start with cryptopyrroles. He has a pretty high cryptopyrrole, which is sucking his zinc and B6 out, essential components for making neurotransmitters. So he definitely needs to be treated. And I said to the mother, I typically start with a urine test for young children because they are afraid of needles. And why do the trauma of putting them through that when we can find out what disruption or imbalances that they have? And he had the 26.7. But then I said, he's had this for so long. I feel like to really be effective in treating him, we need to know what his level is, and is his copper low or high, rather. So this is what we found. His zinc level was 56. That's half the amount of zinc that you need. And that is the reason this young man couldn't read. He has learning disorders. He couldn't soothe himself because he wasn't making GABA. And he has made significant progress on this protocol by bringing his zinc up and reducing his cryptopyrroles by adding the B6 and other nutrients as well. So a very exciting case for this mother because she doesn't feel like she needs to be on antidepressants anymore. Okay. So one of the things that in treating children that I do is use a chart here called metabolic weight analysis. So the protocols Dr. Walsh uses are for 160-pound adults, but for children, you need to adjust those doses. So I use this chart, and he weighs 109 pounds. So for vitamin C, instead of getting 1,000 milligrams, he would get 0.78 of that, and that would be 780 milligrams. a little bit hard to find in the uh, store or in any of the places you're buying your nutrients. However, you can adjust it and make it like 500 in the morning and maybe 1,000 at night, something like that, and use separate nutrients. I'd like to put a shout out for Village Green Apothecary in Maryland, where they compound these nutrients. So one of the most significant problems with treating people and kids is the lack of compliance. And if you have to give them 5 or 6 different pills every single morning and 5 or 8 different pills at night, that's going to get old very quickly. So the compounding pharmacy, which they will give you an account to help you do that for nutrients, but not for drugs. They can get these very same nutrients in 1 to 2 capsules. Great. And they also pull out any other things that that you can see are put in vitamins and nutrients in health food stores. It's just the pure nutrient itself, and there's no other excipients or anything's added. And the other thing is, if it's coming from Village Green. If it says magnesium or vitamin E, you're getting that and not maybe a compound or a nutrient out there that may not have exactly what it says it has in it. And that's very common. So that is a great resource for people to use. All
I
right.
just want to
So
say DHA
yeah,
also uses Village Green Apothecary. It really is a really great compounding pharmacy. And like Dr. Delaney said, compliance is king when it comes to working with any patient populations. It can be adults, children, it doesn't matter. It's all about compliance and making it easy for them to make these behavioral changes. So just one more vote for Village Green. And I do have a question. I think it's great you're talking about children because we get a lot of questions from our practitioners about working with children. How soon are you seeing ADHD in children, and is there an early is too early when it comes to examining them and treating them this way that you're using?
well, usually the parents get it from the schools. And at what point they decide to bring the child in is when they can't take it anymore. They've tried medication, they get side effects. They heard about me that we can do something different. It's variable. And so, you can start these kids on at age 4. You just get to use that weight analysis chart to get the right dose for that size of a child. So this can be started young ages. And I haven't treated a 2-year-old, but I'm pretty sure if you find these imbalances in the child, it is really good to start them as soon as you can. Because working with these criminals in the prison that Dr. Walsh and Pfeiffer found, that if they caught them young, they were more compliant and they saw the changes. But the prisoners, they had established certain patterns and they would stop taking their nutrients. They didn't have compounding back then. And so it wasn't that helpful for these adults who have found this lifestyle and are adjusted to it. Okay. Does that make sense?
Yeah, that was great. Thank you.
So, here's what I call the desert island treatment. If you can only take 3 things with you on to the island to treat the high pyrroles, you're going to take zinc, B6, and P5P. Or maybe the family can't afford more nutrients. That's what you're going to give them, those 3 things. And there are several companies out there. Brain Science Nutrition is one of them who puts that in a formula for you. But if you have the option of giving them more and you can get it compounded, or the kids can just swallow things, they need the antioxidants C, E, A, and D. Remember, this is oxidative stress on their brain to have high cryptopyrroles because it depletes those nutrients. So this will help. And if you find a child has high pyrroles, they respond so quickly to the proper dosage and type of nutrients, Dr. Walsh says you can find improvement in 1 to 3 weeks. I say 2 to 3 weeks, which parents are really stunned because the kid who's running around opening drawers, pulling things out is now sitting down, calmly having a conversation within a month. And it's like, it feels miraculous to them. So in children with very high pyrroles, you should avoid omega-3 fatty acids. So I know this is something that everyone needs fish oil fatty acids. If you have a very high pyrrole, like 50s and 60s, and even in the 30s and 40s, you want to use omega-3, avoid omega-3 and use omega-6 fatty acid. He recommends evening primrose oil. Okay, so here's my little spiel about supportive therapies. So I am all about eating real food that has nutrients in it. And 75% of the people are getting their foods out in restaurants and fast foods. So maybe not initially, but begin that conversation with mothers and dads about eating nutrient-dense foods. And I am also a fatitarian, so I do not believe in eating processed oils and foods, that these oils are really toxic for you. So I highly recommend eggs and butter and cheese and cream. And these are nutrient dense foods, and particularly the fatty, fat soluble nutrients, A, D, E, and K. And so you want to avoid these processed foods and oils, partly because they have some dyes in them. They have terrible things in it. There's nothing good for you in a donut, which contains 6 teaspoons of sugar in it, white flour, and bad oils, fried and bad oils. So begin that conversation with these parents or with themselves if you can. Sometimes it's hard to control that in kids or in adults, but you can plant the seeds. So one of the other things I want to introduce you to, this book called Spark by Dr. John Rady, who also wrote Driven to Distraction about ADHD. And this was a study that they did in Illinois with 19,000 students in that school system. And what they did is they took them outside every morning and ran them and they tracked their exercise protocol. Long story short, they tested these children for scores, and it turns out they could read better, their focus was better, and they were the highest scores in math in the world, this group of young people. So I highly recommend, if any of your kids or any of your clients have this, I said, just let them run around your house 10 or 20 times before you send them to school. That is a really good idea. And get them off their devices. So sleep is another really, really important thing, that people need much more sleep. And really, it has a lot to do with how your brain is able to function. Less depression, less anxiety, and better focus from getting sleep. And so then targeted nutrients, and I use the Walsh protocol to determine what these kids are deficient in or have excess in. Dr. Walsh says you can give too many nutrients, that people come in with a bag of 40 bottles of things. You should try to eliminate some of those things. I have those clients, and they do better off the 40 bottles of nutrients that they purchased on the internet. And I do believe omega-3 fatty acids, rather, except for high pyrroles, are really effective because these kids aren't getting them in their diet. So these are important things to do. What I want to leave you with is ADHD is not a D. It's not a disorder. It's a condition. And if you really look at these children and help decipher what they need through the blood and urine testing, you will have a tremendous impact on their lives and really change the trajectory of their lives, the way they feel about themselves, their ability to be successful in life, to hold down good jobs, to go to college, all sorts of things. And you can do that in your little office. So what you want to do is just address the underlying biochemistry. Doesn't matter what the disorder is called. Use these targeted nutrients to fix that. And then, like I say, combine these supportive therapies to help these children's brains so they can have high nutrient rich foods. Exercise helps stimulates those synapses. Sleep does the same thing. And pulling these kids off screens is all these things are really important for helping them be more successful in their life. So that's all.
Are OCD patients usually undermethylated?
Yes, they usually are.
And then could you comment on the biochemical role of niacinamide in overmethylation and the dosing, and niacinamide in osteoarthritis?
Well, that has been a treatment that niacinamide in osteoarthritis was from way back in the 50s that has been effective. I used to use it. I don't do it so much anymore. So I'm not really up on it right now. What was the other question about niacinamide?
Use in osteoarthritis.
Yeah, that one, that's what I'm referring to. I'm not that familiar with that treatment. I used to use it, but
Mhm.
it is a treatment that they used in high doses back in the 50s and 60s. And some people still use it. But the other question about niacinamide, how does it work? That the question? It works.
Yeah, they're asking if it would help with overmethylation.
Yes, that's one of the two nutrients that you use. And it again varies with person's weight and their whatever, but usually I think it's 500 milligrams in the morning and 1,000 at night.
Hmm.
But again, that's weight stuff.
Hmm. Um, would homeopathic therapy help with ADHD? I love this one because I know you're very trained in homeopathy.
Yes, that's my really my first specialty. And I use homeopathy on all of these kids. And sometimes I feel like that is the thing that works. But I was in conversation with a friend of mine of, and if you use acupuncture, body work, chiropractic, and all these other herbs and things to help the situation, it will help. But if you don't address the underlying biochemistry, it's not going to fix it. So,
Hmm.
for instance, I think this child with a 56 zinc has been helped with a homeopathic remedy as well. And he was also helped because we took him off milk. And that was a food allergy that was helping to create the bedwetting, but it also affects your brain. So the mother felt even after we just did the milk withdrawal for 2 to 3 weeks, and he was beginning to make some changes. So the food allergy affects many parts of your body, your skin, your brain, your bladder, and everything else.
Yeah, that's really interesting. We did get a question about that. We're still getting more questions about the folic acid thing. So can you go through the folic acid, folinic acid, folate for undermethylation, overmethylation, why you use them, why don't you use them?
Okay, so you don't use them in undermethylation, only overmethylation. So the okay, let me go to SAMe first. Okay, so SAMe is a natural SSRI. Okay, and an SSRI is a serotonin reuptake inhibitor. Okay, now so it inhibits the serotonin from being it, when you fire a nerve, you fire it into the cleft and it fires the other one, but it reuptakes it. Okay, the the neuron takes it back in, but the drug prohibits that reuptake. Okay, and so I call them the transporters are like vacuum cleaners. So it turns off those vacuum cleaners. Okay. So you can't, an SSNRI does that. SAMI does the same thing, except it takes a long time to do it, like 3 to 4 weeks, because it has a different mechanism of action. It works on a genetic level. So it turns down the vacuum cleaners or the reuptake receptors. Okay. And folinic acid and folates has a totally different, the opposite effect. It doesn't turn them down. It pulls that, it vacuums the cleft sooner because there's too much of the dopamine or serotonin in that cleft. Well, that's a basic understanding. But, and again, the folic acid works on a genetic basis. It's not a deficiency or turning this on or that on. It works on a genetic basis. And Dr. Waltz struggled with this for a long time. He couldn't understand why this was, but they discovered that was the reason that it worked.
Mm-hmm. Is there a similar nutrient therapy approach to pandas?
Yes, there is. You know, you would test them as well, but that would be just part of what you do. It's not the whole protocol.
Do you know if there's any movement towards insurance companies helping to cover these type of testing? I mean, a lot of times they'll cover a CBC, iron sometimes too, but the zinc and copper, are you finding that some insurance companies are covering that?
Yes, some insurance companies are covering it, but a lot of insurance companies do not want to cover whole blood histamine because they feel like, oh, what is that about? So
Mm,
it's much more expensive for your patients to, do it on their own with LabCorp than it is through DHA. You get a
mhm.
significant savings through DHA. So
Yeah. Well, I appreciate the plug, Dr. Delaney. Lisa is asking, what about methylfolate? How does that compare to folinic acid?
it it is a type of folate, okay, and you can use that. However, the pharmacists that I talk to prefer that they use cyano um, folate versus no, that's cyano B12. Um, so the methyl group in that methylfolate is actually uh, turns over very quickly. So you can use methylfolate, but they do prefer the cyanofolate. Okay.
Mhm. I have a question. So we're most well known for our cryptopyrrole analysis, which is used to analyze for pyrrole disorder in populations like ADD, ADHD, autism, schizophrenia, bipolar disorder, pretty much any mental and emotional condition, depression, anxiety, etc. Are there cases where you're having patients that you're just running the cryptopyrrole analysis solely, or are you always checking for zinc and copper?
Well, if it's like a 6-year-old um, who doesn't want to get a blood stick, this is very individual. I will start with a cryptopyrrole.
Mhm.
But occasionally I have a young man who's 6 and his cryptopyrrole was 7. So I went, okay, it's not there. It must be somewhere else. And sure enough, he had a very low zinc and a very high copper. And that once we rebalance that status, he's a different child. And he um, is an autistic child. And so he um, has really greatly improved in his classroom, whereas he'd gotten thrown out of 3 to 4 classrooms before. And now he's their star student. And his imbalance was the copper zinc.
Wow, that's a great point. That's a plug I sometimes use. You can test really young kids for pyrrole disorder because it is just an at-home urine test and it's not as invasive as blood. And to do a metabolic panel, I mean, you're either going in for blood a couple times as a young kid, or you have to be probably what, like 100 pounds, something like that, to get all that blood in one sitting. So it's just one more point for the cryptopyrrole analysis.
They use the pediatric tubes for them,
Hmm.
so they don't take as much blood.
Thank you. Okay, two more questions and then we're going to wrap up in the respect out of your time. So Janice is asking again about the niacinamide. Do you know how it's working biochemically in over-methylation? Like how does that work in the methylation cycle?
It's not working in the methylation cycle per se, but Dr. Abram Hoffer used niacinamide. He was very well known, and I think so did Carl Pfeiffer on schizophrenics. But it has a similar effect, uh, and I think as the folate. I'm not exactly sure of the biochemistry of that one, how it is affected, but it is useful for over methylators.